Today, I'm going to bring you something about the future of color and emotions. I will divide it into the following sessions, which are namely emerging research areas, cross cultural studies, and multidisciplinary convergence to promote the development of color therapy. First of all, let's talk about the emerging area of research, the color therapy in virtual reality. With the popularity of virtual reality, which is the VR technology, color therapy is gradually being incorporated into a more immersive experience. While traditional color therapy may be limited to static virtual displays, VR technology enables dynamic, interactive color environments. For example, patients can experience a gradient of green to a soft yellow in a virtual forest scene and feel the psychological smoothing effects. In addition, these scenarios can be integrated with audios, haptic feedback, and scent simulations to provide patients with a multisensory and integrated experience to improve outcomes. Through the biometric monitoring, for example, heart rate, brain waves, gravitate skin responses. Color scenes in virtual reality can be adjusted in real time to suit the patient's mental and psychological state. For example, when a patient's anxiety level is detected to rise, the system can automatically switch to a scene with cool colors such as blue or green, reducing psychological stress. This smart therapy will make color therapy more scientific and accurate, while increasing patients' engagement and trust. The addition of artificial intelligence technology has opened more possibilities for color therapy. For example, by using AI to analyze patients' sentiment data, customized virtual scenes can be generated, not just a single color combination, but also dynamically adjust the interaction of color with other visual elements. For example, AI can use the patient's verbal input or facial expression analysis to recommend appropriate color therapy options, such as soft curve patterns with warm color transitions to help patients relax. In addition to psychotherapy, the application of virtual reality color therapy can also be extended to the pain management of patients with chronic disease. Studies have shown that different color of the environment can have an impact on the body's pain threshold. For example, a cool tone environment may help reduce pain, while a warm tone environment may provide more positive psychological cues for the patients. This technique has been explored for applications in areas such as post-operative recovery, psychological support for cancer patients, and more. Next, let's talk about the cross-cultural studies, the global adaptation of color therapy. The emotional meaning of color shows a remarkable diversity across the globe. For example, red is a symbol of festivity and luck in China, while in the West it is more associated with love and danger. Blue is seen as a symbol of tranquility and stability in Northern Europe, but in some Middle Eastern culture, it may convey a sense of indifference. By studying the cultural difference in these emotional codings, color therapy can be more targeted. For example, designing color scenes that are specific to a specific cultural group can improve patients' acceptance and efficacy. To better understand the role of color in cross-cultural, global experiments can be conducted. For example, researchers can set up the same color therapy experiment in multiple countries, collecting difference in participants' emotional responses in the same color scenes. This data not only help us understand the meaning of color in different cultures, but also provides a rationale for the global promotion of color therapy. In the global context, cross-border cooperation will become an important way to promote the development of color therapy. Research teams from different countries can share their practical experience in localized color therapy, such as in North America. Some clinics may focus more on utilizing bright, warm colors to energize patients. In Japan, zen-like color scenes such as pastel whites combined with the pale pinks may be more introspective and calmer. Summarizing these international cases will provide valuable experience in the design and application of color therapy. In cross-cultural promotion, color therapy may face difference in the acceptance of treatment options in different cultures. For example, in some conservative cultures, more understated color combinations may be required, while in open cultures, bolder color innovations may be gravitated. How to maintain color sensitivity in global promotion will be an important topic for future research on color therapy. Last one, let's talk about the future outlook. The multi-field integration promotes the development of color therapy. In the future, color therapy will not only be combined with technology, but also with the help of research in the field of art. For example, combined with music therapy, we explore the combined effect of the linkage between color and rhythm on mood. Color therapy needs to be supported by more psychological, neuroscientific, and social cultural studies. For example, to study the mechanism of color on neurotransmitters, to further reveal the psychological basis of color therapy. With the popularity of virtual reality devices, the application of color therapy will no longer be limited to professional medical situations. For example, In the future, home users can use portable VR devices to choose their own color scenes for relaxation and emotional regulation. This will open more possibilities for the popularization of color therapy. Thank you for watching, and in the next chapter, I will bring the content of the conclusion section of this topic.